This is Dr. Karamanukian from the Vein Treatment Centers of Buffalo, Niagara, talking about varicose veins of the feet. Varicose veins on the feet have long been diagnosed but left untreated by vein specialists, also known as phlebologists. Untreated varicose veins in the feet contribute to discoloration and bronzing of the skin, also known as hemosiderosis. They can also cause significant disability and place patients at risk of developing phlebitis, also known as inflammation of the veins. These varicose veins can also be life-threatening with the risk of spontaneous bleeding. Bleeding from varicose veins in the feet can occur without injury and typically occur while patients are in the shower, where the skin is warm and the veins are most likely to be dilated. Immediate leg elevation and digital pressure on the vein can control the bleeding. Placing a towel on the bleeder is dangerous, as the towel can absorb a lot of blood and not provide adequate direct pressure to stop the bleeding. Once the bleeding is stopped, the patient should call 911 and go to the emergency room and seek emergency treatment from a vein specialist. Often, emergency room physicians find the vein which has stopped bleeding and discharge the patient from the emergency room. This gives the patient a false sense of security. If the bleeding event occurs during the day, they should call a phlebotomist to place a suture on the bleeding vein site to prevent recurrent bleeding and also make plans for further diagnostic testing. The diagnostic workup of these patients in the elective setting is duplex ultrasonography to exclude deep vein thrombosis and also to look for perforator veins feeding these varicose vein tributaries, which increase venous pressure, and this is the underlying cause which eventually leads to bleeding episodes. Perforator veins of the medial surface of the foot are 5 types. They occur in the medial malleolus, or on the inner ankle, the navicular bone type, the posterior group type, the median group type, and the anterior group type perforator veins. Once the perforator veins are mapped, then a decision is made as to how to treat varicose veins of the foot. Sclerotherapy is an option, and so is microphlebectomy using local anesthesia. Concomitant truncal venous insufficiency of the saphenous veins should be treated prior to treating varicose veins of the foot in order to make it successful and to reduce venous hypertension originating from these superficial veins. Following endovenous laser therapy of the saphenous veins, or the Claravane procedure, perforator veins are treated with special EVLT laser catheters, and finally microphlebectomy of the existing tributary veins that are enlarged. If the problem is isolated to the foot varicose veins can be treated with foam sclerotherapy or microphlebectomy. I am a member of the American College of Phlebology and diplomate of the American Board of Phlebology. I can be contacted by calling 716-839-3638 or by going to www.veinsveins.com. We welcome patients from Canada. Our office is at peacebridgehealthcare.com. We are less than 50 minutes away from major cities in the southern Ontario area, and in 99% of cases, we should be able to treat you the same day. Thank you for contacting us. This is Dr. Karamanukian of the Buffalo Niagara Vein Treatment Centers and www.veinsveins.com and www.peacebridgehealthcare.com.